All right, officer, if you could get us started, please.
Test it. Good evening, ladies and gentlemen. Before we get started, if anyone here needs an interpreter, Mrs. Hernandez, which is standing in the back of the room waving her hand, see her and she will assist you. Please, may I have everyone's attention? Before the meeting began, we ask that everyone please silence your cell phones. The Fort Bend ISD Board of Trustee meeting is an open meeting for the public to observe the board conducting district business. Therefore, patrons may only address the board during the designated audience item section on the agenda. If you have printed material you want to give to the board members, you must provide them to board recording secretary Gary Rozier up in the front or to me, and we will provide them to the board. We also ask that members of the audience be respectful of others by remaining socially distanced from each other, wearing a disposable or cloth face covering over your nose and mouth at all times, and remaining quiet so that everyone is able to hear the proceedings. Thank you.
Thank you, Officer Walton. The time is now 6:02, and this hearing is hereby called to order. We have the presence of a quorum attending both in person and on video conference. Notice of this meeting has been posted online and at the Fort Bend ISD Administration Building for at least 72 hours. The hearing is being live streamed to the district's YouTube channel, and a recording of the hearing will be uploaded to the district's webpage following the conclusion of the hearing. Right. So our first item on our agenda will be item 2A1, conduct a public hearing regarding the expansion of healthcare services provided by Fort Bend ISD to include the mental health services. Dr. Dupree?
Thank you, Madam President. I'm going to introduce our team in just a second, but I do want to point out that this evening's hearing is being conducted to fulfill the legal compliance requirement for opening mental health clinics in Fort Bend ISD. This is a hearing that we should have by law conducted when we originally opened the centers over a year ago. It has been pointed out recently that we failed to complete that requirement, so we're making up for that. We're remedying that situation tonight. So we will be conducting a public hearing, and then the community will have a chance to weigh in as well. So I'm going to ask our Chief Academic Officer, Beth Martinez, to begin this evening's presentation. Beth?
Thank you. Thank you, Dr. Dupree. Good evening. Well, on behalf of our entire Social Emotional Learning and Comprehensive Health Department within the Academic Affairs Division, I would like you to know how very grateful we are for this opportunity this evening. As Dr. Dupree mentioned, we're here to fulfill compliance, but it's more than that for us. We realize that we did not hold the public hearing, and we regret that terribly. And more importantly, we see this as an opportunity to bring information to you as board members and to the greater community for services that we have in place to offer for our students comprehensive health, and that includes mental health services. And this evening, we're going to be sharing with you the Comprehensive Health Services Plan, information about our Victims of Crime grant and the associated resolution we'll be asking the board to consider on Monday night. And we're also going to be sharing policy that guides our comprehensive health services program. So we are here to fulfill the need in law and in policy that we missed. Our hope is that people will hear the message and learn about services they might not otherwise have known about, so that we can better serve the health and well-being of all of our students in Fort Bend ISD, support our parents and our staff members in assisting and supporting our students. And so with that said, before I turn it over, though, another important component of tonight's public hearing, as you as board members know, is the opportunity for public comment. And so that is definitely an important part that we missed when we shared parts of our health services plan and asked for approval on procurement items to the board over the last couple of years. While we had an opportunity for audience feedback, there was not the designated opportunity for public comment. And so that will be a valuable component of tonight's presentation as we hear from our public. And so with that, I'd like to turn it over to Dr. Pilar Westbrook, who's our Executive Director of Social Emotional Learning and Comprehensive Health.
Thank you, Ms. Martinez. So as we begin tonight, I just want to address, I have to turn it on. I just want to address the pieces within policy as well as law that we are required to ensure that we cover in this presentation. These are the compliance pieces. So this falls under policy Ffae legal, as well as Chapter 38 of the Texas Education Code. The pieces include that you'll hear tonight are health services that are being provided, the expansion of those services, our plans for the future, what federal law says as far as what we're required to allow parents to see and what we keep confidential, as well as the medical records and who has access to those medical records, pieces around grant funding, what we will be using our grant funding for, and we'll be talking about our resolution that we're requesting approval for, titles of persons who have access to these medical records to keep them secure, our security measures that protect our students' medical records just like we would our student records, and we will also be talking through policy Ffae as we will be seeking approval at the March 29th board meeting. So all of that is the compliance piece, but the why for all of these services is the key. We know that this is not a Fort Bend ISD alone issue. This is a global issue. These are needs across the U.S. that we see in the media on a daily basis now, sadly. We know that we need to destigmatize mental health and make sure that our students, staff, and families get what's needed in order for them to not only be able to learn, be able to facilitate learning, and to grow. We need to be able to provide the services that we have in the district in order to allow students to meet their needs and ensure that they are available for learning. As we do this, Fort Bend ISD has actually been on the forefront. They've been leading the way. They've recognized the needs of students, staff, and families and want to ensure that they meet those needs. We also know that part of this need aligns with destigmatizing mental health services for students and their families, as well as our community as a whole. We need to make sure that just like something like diabetes or cancer, we meet the needs of our students and families. Gone unserved, unchecked, those mental health needs will just continue to exacerbate. After Hurricane Harvey, a grant was received to provide mental health services, and it was used in the district for those families affected by Hurricane Harvey that had trauma from that event. During the spring of 2019, the district staff traveled to the capital in Texas, Austin, and they looked at what Austin ISD has in place for trauma-informed care, the mental health services they've been providing as a large district in Texas. The district created a task force, the school counselor task force, as well as the mental health design team. These two groups, along with this research within Austin ISD, working with our legislature and looking at what the needs were in the 86th legislative session, the rising rates of suicidal ideation, all of these pieces meant that we needed to provide services beyond our school counselors, as well as knowing there are lots of things on our school counselors' plates already. As that task force was adopted in 2015 and continued to align its work into 2019, a comprehensive counseling program was built out. There was a needs assessment. We continued to add on to those tiered supports. The mental health design team in 2019 continued that work to create the division. This division was new to the district, and it's the division that I now lead and was brought in to the district to lead. The foundation for our continuing work in expanding these services included adding 5 mental health counselors in the district. With the inception of the Social Emotional Learning and Comprehensive Health Division in 2019, we continued to work on, and we are continuously working on, recursively improving our processes, aligning from Tier 1, 2, and 3, and we'll discuss those this evening so you have further information. We did all this knowing that we're doing it in the vision of a profile of a graduate, ensuring that we recognize that the social emotional needs of our students are met. Gary, can you help me out? Thank you. So as we expanded services, we're working to reduce the barriers that often inhibit families from seeking mental health supports. All of these things include reducing access issues, stigma, financial barriers, attendance issues, reasons people may avoid using these services. We know that if this takes place at the school, we reduce the number of absences in classes students would receive. We make sure that students receive the services that are needed so that they're available for learning. And additionally, we reduce the travel barrier for parents. We know that as we continue our work, we're going to have to continue to battle the stigma. This evening, we're going to continue to explain the services, how they're intermingled, and how these services are paid for. I'll now hand the mic over to Steve Shields, our Director of Behavioral Health and Wellness.
Thank you, Dr. Westbrook. The need for expanded Tier 2 and Tier 3 supports came from a variety of voices and sources. First and foremost, the Board of Trustees recognized the need for and has been the driving force behind this expansion of these innovative and equitable supports. The board and district goals around student ownership of behavior, District Goal 2, developing social emotional skills in a safe and collaborative community, Goal 3, and the vision of a profile of a graduate served as the foundation and framework for the expansion of Tier 2 and Tier 3 supports. As Pilar mentioned, the School Counselor Task Force assembled in 2015, which consisted of parents and students, as well as district and campus leaders, identified Tier 3 mental health supports as one of their most critical and important recommendations to improve their supports of students overall. The mental health design team was convened to create the blueprints of the Department of Behavioral Health and Wellness, along with applying for the VOCA grant. And the student voice was heard through a dramatic increase in suicidal and homicidal ideation, as indicated in our risk assessment data. With this need clear and the district goals and vision to support and drive it, the board took the following actions to expand Tier 2 and Tier 3 health services, which I'm going to cover now. This journey began in May 2019 with the board approving 5 new Fort Bend ISD mental health counselors who are licensed professional counselors and available district-wide. In August 2019, the Mental Health Services Request for Proposals, or RFP, was presented to and approved by the board in a public hearing. The RFP focused on expanding Tier 3 mental health services with community providers funded by the Victims of Crime Act, or the VOCA grant, to ensure equity and access to all of our families. In October 2019, the district received their first VOCA grant funds. In May 2020, the board's resolution to apply for year 2 of the grant was approved. In August 2020, the request for qualification, or RFQ, was approved by the board, which solicited qualifications for student and family medical and mental health services at no cost to the district. These services include the future staffing of the Ridgemont Elementary campus-based health clinic, developing a telemedicine infrastructure to support the growing health needs of our families, and further expanding mental health services throughout the district. The ultimate objective of the RFQ is to provide sustainable, accessible, cost-effective, and high-quality health services to our students, families, and staff. The health services secured in the recent RFQ are still in the review and planning stages. Finally, we received the Year 2 VOCA grant in October 2020, and we are currently in the process of applying for Year 3. Therefore, there is a need to approve a resolution for the third year of the VOCA grant, which will be on the agenda for approval at the March 29th board meeting. If awarded, the third year grant would begin October 2021 and continue through September 2022. And now Sarah Morvant, our Assistant Director of Behavioral Health, will share more details about our mental health partners.
Good evening. So based on the board's approval, the following providers were chosen to serve our community: Clear Hope Counseling, Communities and Schools, and InvoCare Impact. All providers, with the exception of Communities and Schools, are licensed professional counselors that provide individual, group, and/or family therapeutic services. We have memorandums of understandings, our MOUs, and data sharing agreements that we enter into with each of these providers. There's also a review process that is part of the annual comprehensive health and the SHAC updates. The vendors, they provide data to us regularly. Through a shared report, we have access to real-time notice of referrals that are made. And monthly, we also receive a report of students that were seen for services along with their method of payment, whether it be the grant, insurance, Medicaid, or their self-pay. Whoops. In 2018, under the Rebuild Texas grant, Fort Bend ISD partnered with Clear Hope Counseling to begin work with students at 8 of our campuses. We have expanded our partnership to now serve 22 of our secondary campuses. Clear Hope Counseling and Wellness Center was founded by Heather Lambert. She's a former public school counselor in 2017, and they have offices located in Pasadena and in Sugarland. The team that supports Fort Bend ISD is comprised of 7 therapists, and they currently offer services in English, Spanish, and Vietnamese. Clear Hope works with our VOCA grant, and they also offer families options for private insurance, Medicaid, or self-pay. Invo Healthcare or Impact, they partner with 8 of our elementary campuses and 1 of our middle schools. Impact, which stands for Invo Multidisciplinary Program to Address Childhood Trauma. They utilize a multidisciplinary approach to the treatment of students struggling with mental health challenges and social and emotional issues at home and at school. Interventions are delivered in a school setting by mental health professionals experienced in providing trauma-informed care. Knowledge of behavior support interventions is also utilized in the school setting to help students achieve and classrooms to run more effectively. Impact therapists work in the school during the teacher's hours, closely collaborating with school staff and administrators while being in constant communication with the school mental health liaison. They are considered a representative of the school, and regular support is provided by an Impact clinical supervisor. This partner works with students that qualify through VOCA funds.
So Fort Bend ISD also has valued physical health providers, which currently include See to Succeed and Project Saving Smiles. See to Succeed is a nonprofit organization who provides vision exams and eyeglasses to our students ages 6 to 18 at no cost to the district or to families. The goal of See to Succeed is to provide a full eye exam and glasses to children that are identified by school nurses of failing their vision exam. The See to Succeed program is offered in collaboration with Houston Health Foundation, Access Health, Fort Bend Health and Human Services, and other organizations. In 2019-20, 330 identified students had the opportunity to receive a full eye exam by a skilled optometrist, and 270 students received quality eyeglasses of their choosing during the pandemic and free of charge. Project Saving Smiles offers no-cost dental screening sealants, fluoride varnish, and oral health education for second graders at our Title I campuses. Approximately 500 students have been serviced annually in Fort Bend ISD through Project Saving Smiles. It has been suspended the last two school years due to the pandemic. The Houston Health Department and its partners carry out this project in conjunction with Alvin ISD at our own Hobson House Fieldhouse, where the dental services have been performed. The program goals are to reduce dental cavities and to decrease school absences due to oral health issues. After the screening, a written report is provided for the student to take home. We hope to resume these valuable services next year. I'm going to turn it back to Sarah.
As we look to the future, we are working on plans to partner with Sugarland Counseling and TCHAT, which is Texas Child Health Access through telemedicine. These providers are also licensed professional counselors that provide, again, individual, group, and/or family therapeutic sessions. And in addition to these services, TCHAT specifically, they offer short-term crisis intervention with a psychiatrist, and they can offer medication management if it is needed. For our partnership with Sugarland Counseling, we are working to begin at 5 campuses, 4 secondary and 1 elementary. Sugarland Counseling Center was founded in 2006 by Dr. Karan Mishra, who is a graduate of Fort Bend ISD's Dulles High School. They have an office located in Sugarland, and they are looking forward to begin these campus-based services with us. They will accept private insurance and self-pay. I'm going to give it back to Steve.
Fort Bend ISD future physical health service providers include Ibicina Foundation and Virtual Care for Families. During the request for qualification mentioned earlier in the presentation, the board approved the Ibicina Foundation to staff and run the campus-based health clinic at Ridgemont Elementary. This would provide the surrounding community with accessible and convenient medical services with the goal of keeping students in school and limiting the travel and time off of work for our parents. Students would receive preventative treatment like flu shots, as well as basic medical treatment for injuries and illnesses. These health services at Ridgemont would be in collaboration with the school nurse, with the administration, and with the family's primary care physician. Finally, our families will be billed for services like they would at a typical health clinic, which would use private insurance, Medicaid, or a sliding scale for the uninsured. There is no cost to the district. The pandemic has further encouraged the administration to pursue telemedicine possibilities for our families across the district. Virtual Care for Families has a network of pediatricians who would partner with our school nurses to provide convenient virtual visits on minor injuries, illnesses, and conditions with the same goal of reducing student absences and parent time off from work. Parents must consent to and will typically participate in the virtual health visits. The summary of the visit is provided to coordinate services with the student's primary care physician. This option, like the Ridgemont Clinic, remains in the planning phase. So, turning our attention to medical records. So all campus-based health services and records are confidential, as required by the Texas Education Code, Chapter 38, and policies FFA and FFAE. Parents must provide written consent for the services and will have access to the records with the possible exception of child abuse cases for the purpose of student safety. The only health professionals who have access, the only mental health professionals that have access to the child records are licensed professional counselors and licensed clinical social workers. As far as medical records, only registered nurses, physician assistants, and physicians will have access. Fort Bend ISD's health partners have entered into signed legal data protection agreements with Fort Bend ISD to comply with our high standards, as well as the legal requirements under FERPA. For maximum HIPAA compliant and for maximum and HIPAA compliant protection, all of our partners will use the secure electronic records. So our funding sources, as we've touched on a little bit, uses a variety of funding streams to support the sustainability and the expansion of health services to families throughout the district. These funding sources include the district's 199 budget, Title I, Title IV, the VOCA grant, private insurance, Medicaid, and self-pay. C to Succeed, Project Saving Smiles, and TChat are self-funded and provide their own services at no cost to the district or our families. Each provider collaborates with the families to select the best funding option for their unique circumstance and situation. When the partner district and grant funding are used, there's no cost for our families. If grant funding is used, they do not use Medicaid or insurance. I'm now going to turn the presentation over to Ms. Priti Avansa, who is our coordinator of mental health and social work services.
Thank you, Steve. Once a need is identified by a campus in collaboration with parents, a referral is made for mental health support. It is important to know that referrals are not made without parental consent. If the referral source is aware that a client is a victim of crime, it's identified on the referral source, on the referral log, and the funding source automatically becomes the VOCA grant. If the referral source is not aware of any victimization, the mental health provider explores that during the initial intake as well. If the victim is not a victim of crime and has insurance, they are referred to our mental health providers who accept insurance. If a family has no insurance and is not a victim of crime, they are referred to our district mental health counselors. Our partners invoice us once a month. The invoices are reconciled against Fort Bend ISD monthly tracking sheets, and it is completed by the partner and shared with us. We do this in conjunction with the campus sign-in sheets.
All of this is done in line with the multi-tiered system of support. So our multi-tiered system of support is a comprehensive framework. It's used to provide essentially an instructional model to allow for expectations and then when to intervene. We want to make sure we can target our students at the right level and they can move fluidly through the levels. It's rooted in supporting the whole child. The whole child means that we want to support students whether they need mental, physical, social, emotional, behavioral services or intermingled between those. This will allow a struggling learner or an enriched learner to receive what they need at the time they need it in the way they need it. Our goal is to ensure that we build a systematic infrastructure. We also monitor with metrics, evaluating whether student services are successful. We have had variations in being able to track these services based on students coming in and out of the program due to the drop-off of involvement after initiation of the pandemic. The profile of a graduate is our North Star. As I mentioned earlier, it's the vision of the district. We want to ensure that all our students graduate receiving and understanding all of the attributes of a profile of a graduate. So when they've attained those attributes and they graduate and walk across the stage, we know they've made it. To do this, we have built it into the curriculum. Currently, it's not integrated into the curriculum as an embedded part, but we are working towards that as a model to ensure that students, staff, and families know exactly how to serve students in a way that provides profile attribute attainment seamlessly through a lesson. We know that if we provide our services, mental health services as needed, whether from a school counselor, a mental health counselor, a social worker, or physical health services that they might need, and provide for the social and emotional needs of students, students will achieve profile of a graduate attributes. As I mentioned, counselors are an integral part of this process. They're at Tier 1. They assist at Tier 2, and they can move into Tier 3, but primarily they're supporting as the foundation for our students. Along with Profile of a Graduate, we know that the counselors are that support system. But counselors have a lot on their plate. They have a lot of other responsibilities that they are required to perform for the state. At this time, I'm going to turn it over to Carlette Matoyer, our Assistant Director of Counseling Services, and she's going to speak a little bit more about this.
Thank you, Dr. Westbrook. Good evening. So school counselors understand the value of maintaining consistency for students, supporting their overall well-being. And so it's for this reason that school counselors continue to serve and support students with the 3 domains shown here, with collaboration from various departments. School counselors are equipped with the knowledge, background, and skills to provide mental health support. However, our charge from TEA is to balance each of the domains within the scope of our role. The social emotional development initiatives shown here represent a portion, just a portion, of the overall programming delivered on campuses, serving student mental health, but also the overall goal of developing profile of a graduate attributes in students. These include school counseling lessons, individual and group counseling, as well as making referrals to community partners. We now have the benefit of direct partnerships thanks to Fort Bend ISD's Board of Trustees' vision. In spite of the shift to online learning last spring, school counselors had an average of 5,000 monthly interactions with students. Some of the interactions were explicitly designated as personal, which can include mental health supports. We understand, though, when students meet with school counselors, they can broach several topics. And so mental health and well-being discussions could also have taken place during academic as well as college, career, military readiness meetings. Fostering well-rounded conversations supports whole child health. Now, the numbers from the previous slide cannot fully capture the depth and breadth of the school counselor's role regarding student well-being or the dynamic collaboration that occurs to support students. And so I am pleased to introduce Ms. Tahira Shelton, lead counselor at Hodges Bend Middle School, and Malika Easton, school counselor at Macario Garcia Middle School, to bring life and perspective to the figures shown.
School counselors are the filters for mental health referrals. More often than not, we're the first ones on campus to receive information about students having an issue. We live and talk mental health and mental wellness daily. After receiving information from students, their peers, staff, and oftentimes their parents, we consider which behavioral and wellness avenue to connect with the family. Based on the area of concern and speaking with the parent and guardian, students are referred to one of the following groups: a district social worker, a district mental health counselor, an outside therapist with one of our community partners, or to a safe and drug-free school counselor.
Good evening. Student needs are often noticed through academic performance and/or behavioral changes and/or challenges. The student support team on campuses meets to determine which supports are most appropriate to help students succeed. When a student need is identified through the campus student support team, also known as the SST process, the school counselor or nurse can initiate support for Tier 2 and 3 district supports. For example, if the Tier 2 social work supports are identified, the school counselor can request support through the online referral form and work together with their campus-assigned social worker to coordinate supports and/or resources. The referral process is dynamic, and collaboration efforts often occur before a student even has a need. We build relationships with our partners so that when a need arises, we are able to provide support to students without creating delays in care. We are grateful to know that when we need to attend to the other dynamics or domains, we have partners to help us address mental health needs. A byproduct of our community partnership is reduction in compassion fatigue for the school counselor as we collectively address student needs.
So all of this works in tandem through that multi-tiered system of support. The idea is that we want things to seamlessly work for our students and families as well as our staff so that we can provide those services to students. Doing this is done through a collaboration between our counselors, our social workers, our mental health counselors, working together as a team in a professional learning community. They're able to collaborate to ensure that whatever the needs are, that they can be met. So if the safe and drug-free school counselor needs to be providing services, they can reach out to that authority figure to provide those services. If it's a social worker or mental health counselor, they can address those needs. Additionally, Tier 3 is where our students would need individual support, and that service may also be provided by our mental health counselors, our communities and school partners, our mental health counselors on in the district, and some of it could be funded by the VOCA grant. I'm going to turn it back over to Priti Avansa.
Some challenges that we are seeing across the country is that people are isolated and are therefore not accessing services as they have in the past. There has been a decline in CPS and domestic violence referrals and families seeking assistance. With virtual learning, campuses often are not aware of student needs. As a result, the number of students seen by our social workers has fast fallen since this past fall. However, we have seen numbers increase in the area of parent contacts and home visits, which indicate our district social workers are providing support to parents and other adults as they support their own children at home. Our consultation numbers are always high, as they include a very strong collaboration between social workers, district, and campus staff regarding next steps on how students and families can be supported. Our social workers are also integrally involved in providing campus support during crises. I'd like to now introduce you to Emeka Okonkwo, one of our district social workers, very fondly known by his campus and students as Mr. O. Emeka supports Krista McCullough Middle School, Dulles Elementary, Dulles Middle, and Dulles High.
Good evening. We as district social workers focus mainly on 2-tier and occasionally Tier 3 interventions. The majority of our referrals come from school counselors, but we also receive referrals from parents and also students directly. Once we receive a referral and identify the needs, we then tailor our support. It can include conducting student or parent groups, seeing a student individually, working with a family, or referring out to community resources. For our team to work with a student on an ongoing long-term basis, we do need parent consent. Social workers focus on helping students and families who are homeless, who might need transportation, school supplies, toiletries, graduation assistance, or help with college readiness. We also assist students who are struggling with attendance, truancy issues, families and students who are in need of food, shelter, clothing, or mental health services. When families and students have needs beyond our scope of two-tier, we refer them to the mental health counselors or to one of our partner resources. We have social workers in the district who also focus solely on the newcomers, students who have been in the U.S. for less than 3 years, and the needs might be a little bit more specific. We also work closely with our pregnant and parenting students and are truly the liaisons between the family, the school, and the community. Over the past 5 years, I have run boys and girl groups at my campuses that have focused on helping students navigate through the various life obstacles that arise during the secondary school years. This has been in an effort to help them build the attributes of the district's profile of a graduate. We have had licensed master's level social workers in our district for over 20 years, and as school social workers, our primary purpose is to support our students and their families by removing barriers that might impede a student from being successful at school.
The purpose of the Safe and Drug-Free School Specialist is to provide direct intervention and prevention services for students who may need counseling for substance use. Numerous studies have shown that students who do not feel safe and students who are not free of the effects of drugs and alcohol cannot achieve their full academic potential. Without a safe and drug-free learning environment, teachers cannot teach and students cannot learn. The district employs 3 licensed chemical dependency counselors. Students served are those at risk for or involved in substance use. In addition, Fort Bend ISD has an interagency agreement with the Fort Bend Regional Council on Substance Abuse Incorporated to provide prevention and educational services. Additionally, the results from the Pride Survey that is conducted with 7th grade, 9th grade, and 11th graders with FBRC drives this prevention education work that we do with our campuses.
The Safe and Drug-Free School Counselors support all secondary campuses and work with any student that is placed at FHCL for drug-related incidents. When the district pivoted last school year, in March, the Safe and Drug-Free School Counselors began virtual services for students and families, and included in last year's numbers were 1,570 virtual contacts that began after spring break and continued through the end of the 1920 school year.
As we move into Tier 3 services, the numbers in this graph are reflective of students referred and seen by Fort Bend ISD mental health counselors or one of the mental health partners that provide campus-based services. We have broken down the numbers of referrals and how many students were seen each month of the school year. The graph reflects the number of students who were seen for that month, and some students may be represented in more than 1 month, depending on the number of sessions they received. The number of students seen is much higher than the number of referrals. This is because we, along with our partners, were able to provide teletherapy services in order to continue services during the pivot in March of 2019. The pivot affected the number of referrals as seen in the decrease in the number beginning of March 2019, since campuses were not always aware of students struggling unless a student or family reached out for help. The numbers declined in December as VITA was one of our partners who gradually moved away, and the students who were seen by the VITA clinics were given an option of either following up with the mental health counselors, our community partners, or continue with VITA outside of the school district. So that's why you see a little bit of a difference in the numbers in January. With that being said, I'd like to introduce Jesse Moreno, a district mental health counselor. He's an LPC and provides services to Traverse High School and the feeder pattern, as well as Dallas High School and their feeder pattern.
Thank you. If a student is identified as needing more intense and individualized interventions after Tier 1 and/or Tier 2 supports from the before-mentioned providers, they are then referred for Tier 3 mental health services. Our services can only start once we have received parent consent. Our direct services include short-term individual and family counseling, bilingual services for Spanish-speaking students and families, and group counseling focusing on specialized topics such as grief, anxiety, parenting, and newcomers acclimating into U.S. schools. We also play an integral role in supporting campuses during a crisis. If we have a student or family that needs more extensive or long-term care, we can refer to our partners to transition services. Additionally, our team also provides indirect services such as consultations. We often staff cases with campuses to determine appropriate services and collaborate with our community partners. We have provided numerous trainings and presentations for staff, students, and parents. Some topics that we have focused on this year have included self-care for educators, parents, and students, parents' role in supporting the mental health of children, anxiety, nurturing trauma-informed environments, balancing work and home during COVID-19, supporting children's adjustment to the new normal. Although we are a new program, we have certainly gained good traction within the last year and have seen families and students become more receptive to mental health services. We continue and look forward to our work with campuses and other stakeholders to address the stigma associated with mental health. Thank you.
So hopefully through what we've shared with you, you've gained an understanding of what we're providing in the district, what we currently have, the vision of the district, and the future of where we would like to go with our services in the district. We ultimately want to make sure that we're addressing the whole child's needs, whether it's behavioral, mental health, social, emotional, or physical. We want to make sure that we've met the needs of our students and families. We want to make sure that we've addressed all of the aspects and tied them together. We also want to make sure that folks understand that our counselors are the cornerstone. They provide that back and forth support. So as students receive services from mental health counselors, they can eventually go back to a school counselor, receive services from them, provide services and instruction from the counselor to the family so they understand how to navigate the system. We've talked through who our providers currently are. We've talked through who the providers in the future could be. We've talked through mental health, physical health. We've also talked through the ways that we protect the data, what access parents have, and the grant funding being through VOCA, as well as our Rebuild grant, and how those services are paid for through those grant providers as well as through other resources. We've also talked through the titles in the district who can access those records, and all of that's provided for under Policy Ffae and Chapter 38 of the Texas Education Code. We also talked through how data is kept secure. Steve shared with us how that data can be protected electronically, as well as how we're providing protections by who has access to that data. At this time, I want to talk through, if it's appropriate, FFAE. I'll hold on that. So we will continue our communication about services moving forward and answer questions as needed. As well, I would like to share that, as I mentioned before, this is a global issue. But the U.S. Department of Education Secretary said this morning that if we don't provide for the social, emotional, and mental well-being of our students, they will not be available to learn and grow. This is across the country. It's not just here, and we need to make sure we're providing the services. Thank you.
Okay, thank you for your presentation. Do we have a copy of the Ffae local, Ffae AE local?
We may have to take it away.
Okay, all right, okay. Just, I know it was in our packets, but I wanted to make sure we had it here before we go on to review that. Okay. All right, thank you so much for the presentation. Thank you all for the presentation. It was good to see so many of you all. I think we have a lot of questions, but before we go into the question and answer period, I really would like to hear now from our public, our audience. Today we have 3 audience members who would like to comment on this hearing. I would ask that our board secretary, Ms. Grail James, if you could time, yes, each person will be called and you will be asked to come to the podium and provide your comment of 3 minutes. Okay. Okay. All right, can I have Robert Van Kulenbol? Mr. Kulenbol, if you can come to the podium. You will have 3 minutes. Ms. James will give you a 30-second warning. Okay.
Okay. Can you hear me?
Yes, we can hear you. Thank you.
Thank you very much. Ready to go? Okay, perfect. Okay, good evening all. First of all, I would like to thank Fort Bend ISD for providing me the opportunity to speak tonight. Secondly, I think it's really encouraging that the mental health is a top priority for Fort Bend ISD and that the school district superintendent, Mr. Dupree, and the board are aligned on that goal. I think that's a great help for getting this matter resolved. We might have all our differences. You know, I have differences with how you treat stuff, but I know we're all united in our goal to provide the best care for the kids in our custody. Although the goal of expanding mental health care is certainly important, in my opinion, it's not a cure for the root cause of many of the problems that our children face. The challenges they face are legion nowadays, especially with the pandemic. And one of the things is that I believe not having regular schedules, family situations, etc., etc. So I would say let's focus on the root cause of stuff and get the kids back in school. The point with that is that it allows the mental health services as well as to monitor the kids more closely. There's no substitute for seeing a kid and seeing them interact with each other. Also helping the kids out. If the kids interact with each other, they will tell you, and I think it should be a thing that, hey, my friend has a problem. I think that is underestimated right now. And I had to change my stuff a little bit here, but I think that we're in full agreement with Fort Bend ISD superintendent and the board that mental health is super important. I feel, however, that other issues need to be solved first before making this effort. Focusing on the root causes, focusing on basically allowing a better and more efficient approach in that. And I would greatly appreciate it and value it if Fort Bend ISD embarks on a survey, not only basically looking at the children that come to you with problems, but basically assessing the situation as a school as a whole before, during, after pandemic, and the way forward with that, because the results of that will be lingering and we need to start looking at that. So full support, but I think we have to have a targeted approach, not in the results, but more at the root causes for this. Thank you very much.
Thank you, Mr. Cullenbull. Next up, we have Ms. Deborah Hunt. Is she on online, Mr. Roser? Okay, all right. And then next we have Ms. Geraldine Prince Simeon. We can't hear you.
Okay, good evening. Yeah. All right. Thank you for allowing me to speak. It's been a while since I've been in front of you all. It looks different. Okay. When we think of health, our minds consistently are guided to thinking of physical health. However, mental and emotional health are just as, and in many cases, more important for the success of our beings, especially during these times. I have watched and supported the opening of these mental health clinics within our Fort Bend ISD schools and pray for their continuation for years to come. It is clear from the multiple grants at this district that Fort Bend ISD is in need of these clinics, and I'm grateful for the national support to fund these clinics within our school system. Campus-based mental health services remove barriers to providing direct support for those most in need. These wraparound services in the schools are vital for ensuring that our children's academic and emotional success in school and for the children's life. We talk a lot about the profile of a graduate here in Fort Bend ISD. That profile looks to what a successful student graduate is and how he or she comes to be. For many in our community, that success, that profile, would never be possible without the added help that only these mental health clinics can provide. I urge each of you to support these facilities in whatever way you possibly can, for my kids, for your kids, and most importantly, for our entire community. Thank you.
Thank you, Ms. Simeon. We also have Mr. Rodrigo Cameron. Mr. Rodrigo, you'll be given 3 minutes. If you could take the microphone, yes, thank you.
Yes, I believe that this is an important issue related to education, especially y'all see that Colorado shooting. Now they're saying blaming a 21-year-old on mental illness. It was mental illness that was created in high school, but I believe we never treated it.
Rodrigo, will you give us 1 second? Let's make sure your microphone is on.
Yes, that Colorado shooting, that 21-year-old, now they're saying mental illness, and that they recognized in school, in high school, but was never treated. So what's that lead? Well, it leads to health and loss of lives. So it's very important. And to my experience also in education, I graduated from Blue Ridge. I remember having a classmate, and hey, what's my classmate? How come he's not here? It's been a year. Oh, he's in juvenile school, somewhere else. And I believe he having mental illness, but was never treated. And to me, I just I was researching Dr. Field's show. Is it true or lie? He was saying right there, mental illness is affected by illness called ADHD illness, and that needs kind of treatment, medical treatment. Proper medication from a neurologist to be able to treat it, to put our brains back in order, you know. So it's very important. And is 5 councils enough to handle our Fort Bend ISD? And if it's not, well, I believe our principals can do something about it by recognizing if a student has been suspended 1, 2, 3 times. Oh, I believe he should be able to receive medical care by going and seeing a doctor or neurologist to do a brain scan and to see if he has the problem. Because I read, I saw this show and relating this doctor named Dr. Daniel Amen, and wrote a book about ending mental illness. But to end it, we got to treat it. We got to have the proper medication for the students that need it and make sure they're treated. That way they can stay in school and go to school and graduate instead of having problems. Because when I got it from 5th grade, I asked my teacher, how come he's here right here? He's been in juvenile. He should have been felder. No, son, but we just want to get him out of here. Well, what kind of, just get him out of there and instead of getting a proper education and get him out the way. And to me, that's not fair. They need to be treated fairly, come to school fairly, and graduate just like everybody else. Now, not just because he's causing too much problems, they want to get him out of school. No, they got to be treated fairly and fairly by doctors and our schools and principals.
30 seconds.
Okay? It's very important for our principals to recognize it. If they get suspended 1, 2, 3 times, I believe they can receive some medical care one way or another. They can't just leave them behind. Okay, thank you.
Thank you, Mr. Rodriguez. Those are the 4 people I knew about, so I'm going to open it up to the floor if anyone else is here from the public that would like to say something. Dr. Edgardo?
Yes, ma'am, Ms. Haliger. Mr. David Sincere would like to speak. He's here in the audience.
Okay, thank you.
Thank you.
Good evening, everybody. I am Pastor David Lee Sincere, Jr. Tonight, I am not speaking as a pastor or a community stakeholder. I am speaking as a parent. About 6 years ago, my daughter had a mental health crisis. My wife and I were emotionally overwhelmed. We did not have a support system. We were experiencing secondary trauma. We felt lost. Every day was a fight to get our daughter the help she needed. Because she received help, she is now doing great. 4 years later, my wife and I decided to educate ourselves and others. We started Advocacy Now Institute. We connected with mental health experts and started teaching about social emotional learning, trauma-informed care, ACEs, adverse childhood experiences. The one thing I learned is that the mental health stigma is real. Programs like the campus-based mental health clinic helps break the stigma. I commend Fort Bend ISD for offering these services for our families and, most importantly, our children. We must keep pushing forward for the best interest of our community and, here again, our children. I wish Fort Bend ISD offered these services for my daughter. Thank God they offer them now. Fort Bend ISD, God bless you.
Thank you, Reverend Sincere. Are there any other public comments? Okay, that can. Mrs. Brown.
Hi, and thank you for having us here today to educate us on probably what should have been done a couple of years ago. I'm really, really excited that this is happening now, but as a community member of Marshall and other Hightower and Willow Ridge, where these are being offered now in Fort Bend ISD, I think this goes back to what our problem has been in the past, and that's just communicating with the community. And I know that you're doing that now, but all of the effort in what you're doing today, we're just asking that you put the same effort into when you're going to do these types of programs to just educate the community prior to this. So there can be input, education for the families that will be involved. There may be some families out there that may not know that their children are having these issues, And prior to having this in such a wide, I guess, global, throughout the district, there might have been some input that parents could have added to what you're doing today. So I say thank you for what you're doing now, but in the past, we know that there has been lack of communication within the district where it pertains to certain schools. So maybe that's where the kickback is, but let's just take this as a lesson to communicate more effectively when we're talking about putting something in our districts that the parents are not aware of. So I say thank you, and thank you for this time that you're giving us to talk about this, and because it brought a lot of awareness and education to me. Because, of course, I never had to go through that as a parent, but when you say that you have 158 students within the Willow Ridge, Hightower, and Marshall communities that you assessed as suicidal, but you had, I don't know, maybe over 1,000 that you assessed throughout the district, what are we doing and how are you assessing those other 1,000 or 4,000? I don't remember how many it was in the community compact paper, but that supersedes the number that you identified
30
in the
seconds.
Marshall, Hightower, and Willow Ridge communities. So I say, whatever those numbers are that we did not address initially, we need to be finding out what suicide issues they had as well, because that other side of the district probably needs that major housing on that side as well. Thank you.
Thank you, Mrs. Brown. Do we have any other speakers? All right, that concludes our public portion of our hearing. At this time, I'm going to open it up for questions from our board members. And I see Ms. Hannah.
Yes, thank you. I have a couple of questions, and one is very simple. Can you just, someone describe, are the 5 mental health counselors, are they housed on a campus, physically on the campus with a space?
Our mental health counselors are housed at campuses, but they also support multiple campuses simultaneously.
Okay, so they're also providing virtual support or tele-support, or are they driving?
Yes, both.
Both. Okay. And then you may be able to answer this, or it might be Mr. Shields. I think it was Mr. Shields that mentioned the monthly report that comes to the district regarding the services that are received and how the payment works. Can you just help me understand in very layman's terms how we make sure that we're addressing HIPAA and FERPA because I don't know what that report looks like, and I'm just wondering if you could help me understand that.
Sure. So essentially we have a licensed professional, mental health professional, that's receiving that information. So it's under the appropriate titles. And we are having it filtered through her to reconcile to make sure that payment is appropriate and is done through a correct resource and that the services were truly provided. So everything is protected in that way.
And is that also part of maybe the VOCA grant compliance piece? Okay, yes. I wasn't sure how that was working. And then kind of along the same lines with the payment, I know that, I can't remember who described it, that if the child has insurance, they may not be able to access the grant funding. And so I just, I think about my own insurance and the high deductibles that some people have, and they hold off on the insurance. And if insurance, I guess I'm asking, if even if a child has insurance, if that insurance is a barrier to them receiving the mental health service they need, can you describe what we would do to help that child?
Certainly. So our counselors and mental health professionals are providing support to help the families determine what the best method is, and to break down those barriers. Part of that does include making sure that if the family has any reservations, that we would be able to access, if they are a victim of crime, the VOCA grant. And then if they aren't able to access the victim of crime VOCA grant, and we needed to provide them mental health services and they did not want to utilize the insurance, then at this time we have the mental health counselors, the 5, and the 20 social workers within the district that could provide it through our district funding.
Okay, thank you. And Madam President, I'm going to let others ask questions, but then if we do have time, I have 3 more, but I don't want to take up all the time. Thank you.
Okay, thank you. Do we have any other? Ms. Williams, do you have any questions?
Yes, I do. I'm sorry, I didn't want to jump in this. Okay, I'm going to speak just as the pastor spoke. I'm not going to be the trustee right now. I'm going to speak to you as a parent. My daughter experienced mental health issues after attending Garcia Middle School, then going on to Bush High School, where she was pushed to the edge. I would wake up every morning reading suicide letters because the staff was bullying my daughter to death. Didn't matter what counselor I called, what administrator, superintendent, board member, etc. My daughter was damn near killed because of several employees employed by Fort Bend Independent School District. That is why I sit here today. In 2019, when you started these clinics, I proceeded to file a complaint. So yes, I am thankful that you heard me, Addie, and I'm also thankful to the rest of the board members who didn't just turn a deaf ear when I said, no, we need to be in compliance with the law to make certain students who are feeling like my daughter felt back then are really getting the help that they deserve. So for that, I am extremely grateful for that. I'm also grateful for the information that the staff provided tonight, because I didn't even know, I had no idea that we had that level of experience and that level of tears who are out there willing to assist our students. From the outside where I was, I can only judge the district for what I knew it to be. Now I see that you guys really planned for this. I am so happy that another mother wouldn't have to cry the tears that I still cry today for my daughter, because I lost her, because I couldn't get the help that I needed. She's 18 now, well, she's 25 now, and once they turn 18, you can't help them. All you can do now is pray. So all I can do now is pray, but I'm happy that the parents now are going to be able to get the help that they are needing. So I thank my fellow trustees, and I thank the staff who was going to put in the work to make certain that we help our students. And I'm always a phone call and an email away for any parent or any administrator that is needing assistance with this matter. So thank you.
Thank you, Ms. Williams. I think from our perspective, I think the right intent was done by the board when we opened up these clinics. There was definitely discussions that were had. The plans were provided to us, and we failed to have the hearing. And I think I'm glad that you brought it to our attention so that we can have this hearing today. And it also allowed us to get an update on the work that has been done so that we can have some of those statistics. I think when the board initially put this together, there was definitely hopes and dreams of the work that will be done from these programs, but I don't think we knew the full extent of how it would impact our kids and our community. And I think today, what we heard today really showed the good work that's been done. Does it mean that there's not still more work to be done? Absolutely. And that's, what we'll have to discuss when it comes to extending our mental health clinics and our services throughout the district. We have to start small and then expand. We start where our most vulnerable areas are and then expand throughout the community. So I'm extremely appreciative of the work that we're doing, because the profile of the graduate definitely casts that vision for us as a district. And we cannot, I heard someone say that in the public, which was great, is that we can't achieve, our children, our students cannot achieve to their full capacity, to their full, what's the word I'm looking for? Your potential, yes, thank you. Their full potential if they're dealing with other issues. I mean, and I'm going to put my parent hat on as well. And I see a couple people in this room that has dealt with my own child, and we have struggled with our mental health and have an ability. He's coming out of the school now, but having someone to contact or talk to is going to be very beneficial for a parent like myself, who I've also spent many of nights very upset or trying to figure out how I can help my child and what are the services to help my child. So I think this is, to me, I see that this as just the beginning of how we could service our children and our students in our district. I also see us growing and seeing this as being a model program to be used around the state and beyond. So thank you all for the work. We've got more work to do, and we'll continue to do the work. And then I'm going to go back to Ms. Hannah. She's got a couple more questions, and then we'll move forward.
Yes, thank you. I'll make it quick. First of all, the risk assessment survey, Mr. Shields, that you mentioned, is that something that the board has access to, or the previous board had access to? You mentioned, and I'm not sure if it was called risk assessment survey, but it had to do with a survey that you were looking at homicidal and suicidal ideology.
Yeah, so for the past 3 years, our school counselors have administered the needs assessment to our secondary students through Naviance. And so we have the data. We have shared, I believe, last year just kind of an overview of the data. But yeah, we have that's available and accessible. That's one component. And students self-report suicidal ideation, homicidal ideation, as well as depression, anxiety. And another component of the risk assessments that we also started 3 years ago was counselors, anytime they do a suicide or homicidal ideation, they record it in Skyward. And so that way we have that data. It's not just papers in a file. So we can always query that data to kind of see trends and see how things are going. And so that's another way that we're tracking, and was a way for us to really see as these grew that this need was prevalent and it needed to be addressed. Okay,
and that this graph that you shared with us on on slide 30 and 31, if Ms. Helliger might have that on an agenda sometime in the future, looking at our students and their well-being and in terms of profile of a graduate and achievement and just really mental health. I thought this was interesting how the change looked once the pandemic started. So I think that might be something interesting to help the board understand what you guys look at every day, just helping us understand that mental health component a little bit more. And then my last question was the Sugarland counseling that's going to be at Austin Parkway Elementary, I think Elkins, a couple of them, First Colony, First Settlement. Is that a vendor? Did they do an RFP? How do you select the vendors that aren't part of the VOCA grant?
So yes, so they were part of our RFQ, the request for qualifications.
Okay.
That was approved by the board last summer.
Okay.
And so they responded along with some other vendors. And so, yes, so that it was the whole procurement process they went through.
Okay, and my apologies if you said that.
No, that's okay.
And that was just a lot to take in. But
there was a lot to take in.
I do appreciate everyone that presented to us, because I also learned a lot. And to be honest, as a parent, you know, I was raised that, you know, you didn't, you know, with the stigma, like Pastor Eastman, I think, was talking about, you know, you kept your problems behind your closed doors, and you just didn't do that. But we know now that going to a mental health provider is important as going to someone that helps you with your physical health. And anybody that's tried to find a good mental health provider for members of their family, they know it's a challenge. And so I do commend the previous board members. I know that their hearts and everybody's minds were in the right place when they started this, but this was very helpful to me. And thank you all.
Thank you.
All right, so I have some additional questions. Oh, I'm sorry. Okay. So I was thinking, I just want to comment on something Ms. Hannah said about stigma. When we start to normalize mental health as an issue, then not only do the people around that are dealing with mental health or people with mental health challenges, the people who have mental health challenges can also recognize it and are able to easily say, hey, I'm having an issue, and they can recognize it themselves. And that recently happened in my own home, and I was amazed. But that was definitely something that we had to grow into. You have to make sure that mental health is not something that is swept underneath the rug, that it can be talked about and communicated openly, and so that anyone that has had, I don't even joke around with it because it's not to be joked with. And so I remove myself from people who think it's funny, right, when it comes to our mental health. So one of the other issues that I want to see what we're doing is around law enforcement. How are we training our law enforcement as well to deal with maybe some of the mental health challenges that we may have even within our school systems?
Chief Ryder?
Yes, ma'am. So all of our officers take mandatory state mandated training. All of our officers have completed that. That includes how to deal with mental health issues. We have taken a 40-hour mental health officer training class, as well as other 16-hour training classes that we can find. We feel like that's very important for our officers to know how to deal with students who are experiencing a mental health crisis. And the other thing that's important to know is not every mental health crisis needs an officer involved. In fact, very few of them do. And so we recognize that as well. We know that a uniform sometimes escalates the situation, and so we rely heavily and work very closely with the counselors and the administration to make sure that we defuse and de-escalate as much as possible. We do have 2 officers that are specifically trained in crisis intervention training, and that is their entire job. And so when there are cases that need law enforcement intervention, what their role is to help find placement for those students, and they work with the families, and if the families want us to, we will transport them in an unmarked vehicle with an officer who's not in a full uniform, so there's no stigma attached to that, so that we can get them the help that they need.
Thank you for that response, and I'm sure I'm going to follow up with you on some methods that we are using so that I can understand better. as well as, one last question maybe for this team, is the 504. Are all of our, is there any way for us to put protection with our kids by putting them in 504 if they get referred out or get certain types of services?
So I would definitely say that I would like Dr. Hill to come up and speak to that. She is our expert related to 504 and special education services.
Thank you. So for students that aren't already served or identified as students receiving special ed services or 504 services, and they're in a crisis like that, oftentimes there is a referral, and we end up coming with the parents and talking about, do we need to do an evaluation? Many times those evaluations end up having result in the students beginning to see services if they hadn't already.
So they, based on the referral, you all determine whether or not they need 504 services, is that what you're saying?
Yeah, so it's either, so a lot of times students are already receiving the services that may be having these crises. If they're not, then there is a referral made as appropriate, and then they may start to receive them. And once they receive those special ed services or 504, they're protected. And so, you know, they just have an extra layer of protection and rights that are granted to the parents.
Okay. All right, thank you.
Thank you.
Dr. Gilliam?
I just want to express just how absolutely wonderful the presentation was. I would also like to express that what is happening, and I'm going to just tag along, I don't remember who said it, but on this side of the district, that we go to the entire district somehow, somewhere, some way, that there will be parents that hear this that are on the other side and not around this area that deeply need this service. And it's really hard for me to talk. I've got mental illness in my family, and just knowing it is so hard sometimes to just find someone for the parent. It is so hard for the parent to deal with it, because after a while, the parent feels that nobody wants to hear it anymore. And there's so much help when we're actually looking at the student, and then what actually happens with that parent, that mom, the dad, the aunt, the uncle. And I just really, truly hope that from here, that do we have a pamphlet that we can hand out? As a board member, I would like something like this that has this information. I don't want to tell someone to go to the website and find it, because I would feel compelled to stop what I was doing to go and find it. But I want to be able to have it in my car, in my possession, that anybody who needs some help, that I can pull this out and I can give it to them. So thank you so much for the explanation, for sharing, for that we understand what's going on. And at the same time, I was one that I did not know that this was out here in this area. And as I look up at Mr. Glover and Mr. Thornton and all of the different things that happened here at Willow Ridge High School, not knowing that that was here was disheartening. However, I'm very full at this time. So thank you so much. Thank you.
Yeah, thank you for providing that. I agree. I think if we had some type of, just some type of pamphlet of some sort, I think that would be good. All right. Okay, and maybe, I just thought about that, maybe our next communication that goes out from Fort Bend ISD, we have a little bit of information in there that talks about, you know, the hotlines and some of the services that we provide so that people can readily have it. Okay. Yeah. All right, and now I'm going to go to item 3A1, review approval of revisions to local board policies, Ffae local wellness and health services, school-based health center. I think we all have that policy in front of us now. Dr. Dupree or Grales, would you like to discuss some of the changes?
Yeah, so this policy was brought to the board a couple of months ago. We then took it back from the board meeting and reviewed the policy. The committee did. The main thing we did is added a reference to Ffae legal in the opening couple of paragraphs, which is the purpose. Because that's where the information about the public hearings is located, and we had missed that by always looking at the Ffae legal. And so we made that correction and made that reference in here, and besides that, the policy, as I understand it, is very similar to what, or nearly the same as what we brought in January.
Okay, do we have any questions from the board members?
I have a quick question.
Yes, Ms. Williams.
I need to address this with Grell. Grell, is the policy stating that each time the school changes medical services? Because the law states that it's every time the school, like for instance, hypothetical, let's say we put a clinic at Clements, we would have to have a hearing around a clinic being installed at Clements High School.
So yes, ma'am, on page two in the middle, it talks about the public notification requirements. If the district, and this is what it says, if the district creates, expands, or changes the comprehensive health school programs available, appropriate information shall be provided to the parents and the community as required by law. So that's where it would cover that. If a public hearing is required in the law, then we would have another public hearing.
Yes, and Ms. Williams, I would interject as well. Staff will be writing procedures to support implementation of this policy, and they will include specific direction that even if a new clinic is open, if it's an expansion, it would require a public hearing.
Got it. Thank you, Dr. Dupree. Thank you.
Mm-hmm.
Thank you.
All right, thank you all. Go to 3A2, discuss proposed application for Victims of Crime Act grant to expand mental health services in Fort Bend ISD.
Thank you. So the resolution is because we are looking to seek funding for the VOCA grant again for the October 2021 through September 2022 year. And so essentially we are asking for the board's approval to be able to move forward with that grant funding. And we shared with you this evening how we are serving the 8 original campuses, but we've expanded to 32 campuses across the district with these services. And so this would include those services within this resolution.
Okay. Do we have any questions? Ms. James?
So, Dr. Westbrook, if you could just clarify, so the year 2 of the VOCA grant began in October, and then, so we're currently in year 2 of the VOCA grant, and then the resolution goes to, is intended to, so we apply again for the 3rd year that would start in the fall? Is that, my question is what happened in year 2? The information I saw was talking a lot about year 1, and then now we're in year 3, and I'm just trying to fit the pieces together in the timeline.
Certainly. So I think COVID kind of got in the middle of all of it for us. So when we were awarded in October, we received the award notice October 26, 2019. And from there, we began to initiate all the services and put in place the clinics on the campuses originally. As we went into the pandemic, we shifted those services. In October 2020 was when the new grant started, and we are now in spring 2021. And so we're still in year 2, and it's not on the normal school year cycle. It's different, and that's why I think it feels a little bit odd.
Okay, so then the resolution that you're seeking is about going for the year 3 grant. Is that correct?
Yes, ma'am.
Thank you.
Actually, I would like to read the resolution just for clarity so everyone is aware. The resolution, Fort Bend Independent School District regarding authority to submit federal grant application, whereas the Fort Bend ISD Board of Trustees finds it in the best interest of the students, staff, and community members of the Fort Bend ISD that the FBISD continue the Campus Victim Assistance Program K through 12, and year 3 of the program be open during the 2021-2022 academic year. And whereas the board agrees to provide applicable matching funds for the said program as required by the VA Victims of Crime Act Formula Grant Program application. And whereas the superintendent of schools is the district's authorized official, and as stated in board policy CB local, the superintendent is delegated authority to apply for, accept, reject, alter, or terminate the grant on behalf of Fort Bend ISD. Now therefore be it resolved that Fort Bend ISD Board of Trustees approves the superintendent's submission to the Office of the Governor, the grant application for the year 3 Fort Bend ISD Campus Victims Assistance Programs K through 12. Okay.
Ms. Helliger, are you finished with that item?
Yes.
Thank you. I just wanted to make sure the board was fully aware that the 2 items we've just discussed, the policy FFE local and this resolution, as well as a 3rd item, a record vote of the board to expand healthcare services based on tonight's public hearing, will be on Monday's board meeting on the 29th. So all 3 of those items will be on Monday's board meeting. So the record vote is also required by law, so that's just another compliance piece to fully close the loop on this matter so that we're in full compliance and it's all dotted and crossed.
Thank you. All right. At this time, let's see. We will now convene in closed session under the Texas Open Meeting Act, Texas Government Code, Chapter 551, under the following sections. Section 551071, for the purpose of a private consultation with the board's attorney on any or all subjects or matters authorized by law. Section 551072, consider purchase, exchange, lease, or value of real property. Section 551074, personnel matters. Section 551076, security matters. Section 551082, student discipline matters or complaint. Or Section 551081, personally identifiable information about public school student. The time is now 7:38, and we are now convening closed session. I think we have a presence of quorum. All right, so the board president, that's me. The time is now 7:58, and we are now reconvened in open session. We do not have any actions from our closed section items at this time. I'll take a motion to adjourn.
Motion to adjourn.
We are now adjourned. Good evening, everyone.